Okay, so the MRI showed that a lot of the spinal cord injury that was there previously, like the brightness in the cord, has resolved. So that was probably more from the impact of, whatever happened when the fall happened or whatever happened that decompensated. And then the bones look very fixed in place, like very similar to where they were. And I see some additional information that may explain some of the fulcrum of that location. It doesn't look like there's a normal disc at C2, C3. Like, it just looks like the bones are right there. And then it almost looks like the top of those bones are fused. I can show you the x-ray. The MRI looks largely similar but better. I did not do the CAT scan. I just did the x-rays and the MRI because I didn't feel like I needed to after I did it. So I don't know if you remember what the first one looked like. So that curvature is still there, but the cord isn't bright anymore, so it's healed in that area compared to the previous one. Okay. And then, this is actually 3 vertebrae, so 1, 2, and 3, and they just don't look very well defined. The x-rays actually will show you more clearly. If I can open them, if it will open. No, it's not gonna open. Give me 1 second. There you go. Okay, so I'm just gonna show you in a grid the movement of this area. Okay, so first thing is the disc not being there and the fusion. So this is a normal disc space in a healthy young dog, and they all look beautiful from here down. This one's very collapsed here, almost suspicious that something's not quite right formation-wise here. There is a little bit of space though, so there may be just a smaller disc or a degenerate disc, which is really weird at this age to have that happen. So I think that one's did not form completely normally. This is the most interesting kind of, it's almost like C2 is just also not formed correctly, all the way around, not just the dens or the small nubbin of the dens that we have here. So this is what the dens has grown into, which is not a normal thin piece of bone that's gonna lay on the floor of the canal. It's built up inside the canal. But these two bones look like they're fused to me. See, they don't look like they just articulate like those. They look fused. And then this, I don't think has a disc. So there's a missing disc, a mimicking fusion here, what looks like a definitive fusion here. And then this whole thing is one big piece that may have contributed to the rocking of that part. And also the fact that this isn't normal and the ligaments aren't normal. When I do dynamic views, so these are x-rays under anesthesia. This is a neutral spine. This is a little bit flexed. And this is more flexed, which you never would do. You'd be way more nervous if it was acute onset. And so what you're looking at is this distance here and coverage of this over this. So you can see that we go from here, which is neutral, to a little bit tiny bit flexed. It does open a little bit, but as we kind of progress, the change is really fairly minimal, between these 3 views of flexion. So this is if the head's here straight, and it's this, which is pretty significant movement of that area, and it really doesn't move a lot. It moves a little, but we're talking a difference from here to here of less than 2 millimeters, which in normal dogs, sometimes they do move a little bit. So I do think it's still consistent with the previous diagnosis of, A instability and some additional more obvious malformations now that things are just not quite, anatomically correct. But the fact that it's not breaking open and moving would make me tell you that if this were my own dog, I would not do surgery right now. And I know that that's different than what Blue Pearl kind of led you to kind of expect. Right. But the reason is because we have a very functional dog who's 100% comfortable and has some hypermetria, but that's it. No significant weakness really. Is happy, is holding head normally, normal head carriage. And if we did surgery, you know, this is all calloused in, and, you know, especially in a young body, I'm sure there's scar tissue and, you know, things that are holding it in this position. So you have to like go in again and like break down that healing process that's already happened, essentially breaking the fusion that's developed, in order to try to realign it, which I just don't think surgically is a reasonable expectation. Like, I think even if you did break it down, you're not going to go against what has naturally happened completely. So essentially you'd be fixing it in this position, which also brings up like the other difficulties with fixing it, which is like normally you drill screws, you know, through, so you drill screws like through here and through here. Well, you can see there's like a little space because of how it's healed. So I don't know that you're gonna get like a tight like lag of, you know, feeling between those articulations. You could certainly clean them out, clean out the cartilage, and, you know, but putting something across is not gonna really be as strong as a fixation as if you could like make them go like this and then drive a screw through them, if that makes sense. So I think you would be putting like a pretty weak construct in there, and that has a high potential for breakage anyway. Not to mention the risk of like decompensation. You know, I mean, the surgery is tough in the little guys, and she's not the smallest I've ever done, but definitely it is not, you know, even my hands are not that big, but it's harder than you would think. It's one of the most technically difficult surgeries. The other part of it is that this is kind of bulbous and sticking up. The only surgery to address this is an odontectomy, where you have to like go in and try to cut this and like pull it out down here. And I've never done that because I just think like that's like certain death. Like the survival is so low from that. I just don't feel like it is a good option for most, or if not all, patients. If you like broke it off in trauma or something, that might be different if it's free floating. You could like pluck it out of there, but even that, like if you really saw what you had to do to get in there to get that out, it would not be something anyone would want to do. So, you know, I think that the questions are always like, well, if we don't do it, you know, can she, like, is she more at risk for future problems or it happening again? She is more at risk than like Reiki is, for sure. Like, I mean, not a lot probably, because it's done a lot of healing and it's pretty stable. But, you know, could she be a dog one day and jump off a bed or something like that and like have some complication or some issue? Possibly. I can't guarantee that's not. If we drive a screw through there and fix it in place in a poor construct, could the same thing happen? Yes. So that's kind of like what I wanted to see today, is like, do we have any evidence of like progressive injury to the spinal cord? And the answer is no. It looks like the opposite. It looks like it's healed a little bit from the initial injury. And two, you know, could we reasonably fix it without causing a lot of destruction and additional risk that she doesn't need, and or make a good construct that will actually work? And so I think that the risk, in my opinion, and you can feel free to get a second opinion, I will not be offended, in my opinion, it is not worth the risk to her in surgery of what could happen. It could go wrong, complications, you know, I mean, fatalities definitely happen with AA surgeries. Not a lot anymore, because I think we have better imaging and better techniques. But it is possible, you know, and or other complications that are difficult. Like, I've seen dogs need tracheostomies, I've seen dogs need ventilation, you know, there are just things that can happen. It's not a benign surgery. And then two, you know, if the construct is not going to eliminate risk completely for those risks of surgery, then I don't think that it's the right thing, personally. But you guys need to, you know, feel comfortable with your decision also, and so does the rescue. And definitely, like I said, I will not be offended if, you know, you want a second opinion, like, pursue whatever you need to do to make the best choice for her. But I think that that's my general best medical assessment of the situation.
Yeah, so at this point, just continue.
Yeah, I would start to reintroduce activity. I would try whatever you can do to train her / make adjustments so that she's not jumping mainly off of things. If she jumped up onto the couch, that'd be no big deal, really, but jumping down is bad generally. If she has like teeth cleanings in the future, or she's under anesthesia and doesn't have the muscle protection, whoever handles her, like, you know, put her to sleep in the Balto, or, you know, make sure no one's like letting her head flop around, you know, when she's asleep, or have the whole, if she has dental, you can do the whole thing in that, just so that she doesn't, you know, do aggressive movements that aren't natural to her body. But I mean, I think, and maybe I'm a little bit different in my like mental approach to my dogs, I guess, but my thought would be like, let's let her start transitioning back to activity and spending time with Reiki, and, you know, starting to be a dog again and not just confined all the time, you know, and you know, try to navigate common sense good decisions. And, you know, if something happens or changes, then we address it if it happens. You know, if instability recurs, then we can fix it, you know, or we can do something differently. But I think taking a pretty stable situation, destabilizing it, taking chances to imperfectly fix it is just, that's a big ask, I think. And she's doing so, it's not like she's like in excruciating pain and we have to do something, you know, she's doing great, you know. And so I think if you want to keep the ball going for a while, even several months, you know, to skeletal maturity, even like while she's reintroducing to activity and like starting to move around the house and stuff like that, then that's great. I think that's a great middle ground. You know, she tolerates it fine. It's not causing any wounds or problems. You know, it just gives her a little reminder of, you know, some mild limitation. And, you know, and if things get rowdy someday, and, you know, then she'll have something in place while she's still a pup. But I do think like returning to normal dog activity and that kind of thing would be reasonable at this time.
We can definitely start that, yeah. Her activities will
when
get back to normal soon.
Back to normal? Yeah,
she's at 7 weeks, and Dr. Worth said 7 to 9 weeks. We could do another x-ray, make sure that it's completely healed. So we're at that point where we're probably going to x-ray in the next week or two and go back to normal.
Yeah, but I think you can, and you put them on leads, you know, and be in charge, and you know, and their training and their life is going to be a little different, probably just because of their earlier problems. But RUs are, you know, a classic problem in Italian Greyhounds, so that's almost an expected concern, you know, that you have on your radar. So I think, you know, hopefully we won't have any issues with that down the road. I know when I was carrying them out, I was like, nobody trip me, because I'm not going to be responsible for any more RUs. Like,
yeah, but with her ataxic gait, we don't usually leave her unattended at this point. I did try it for about 10 seconds the other day in the yard, because she likes the yard.
Yeah.
And she took off and stumbled and she whimpered a little bit.
Oh, really?
Yeah, so immediately picked her up and let, no, not on your own, not yet.
Yeah, and you can start training her and working with her, like start taking some walks for her when it's not crazy hot, like for exercise, you know, to because the more she practices at this point, like she's been in the rest period, she's not been in the retraining period, you know, so they benefit from doing some physical therapy, from doing, you know, regular walking, different surfaces, hills, you know, that kind of stuff.
Sure.
Just to kind of retrain her body. But, you know, she's pretty steady on these floors, which is pretty amazing. I mean, all things considered, she could easily have passed away from this initially, but she didn't, you know, and she's very strong and she's really doing well. So that's kind of my opinion, you know, and I did kind of prep the rescue for that, which was just some of their surprise. And I'm like, well, if you just think about what you have to do to try to realign it, knowing you're probably, I mean, I've had dogs, I mean, I had a puppy that had a back fracture, like middle of the back, and it had been like, I think it was like 3 weeks old or something, and I could not pull it into alignment. I tried for like 2 hours to like get the fracture fragment up and realign everything. And finally I had to like call the owner from the OR and I said, you know, I cannot realign it. I can fix it in place, like broken, you know, with a little stuff, and I can make it stable. But this is not going back. There's too much scar tissue, and the muscle contracts, and like, you know, your body just does things when you have trauma that make it hard to go against it. And so, and I did, and it turned out fine in that case. And the dog was, you know, the owners didn't listen, but you know, the rest of it was fine. And she's happy, healthy, you know, pain-free and that good stuff. But I think this is a little bit more challenging because there's such a small surface area that you get to purchase anyway. That if you cannot realign it, then you're just leaving your screw out there in the wind, you know, like without support. So I'll write everything down and I'll send it to the rescue as well. Definitely you and Carlos talk about it. You know, again, I will not be offended if you guys want another opinion, or, you know, and I can provide images and everything like that, obviously. But I think that things are not moving more than a couple millimeters, even with deflection, which is a good sign. And hopefully that means that she can tolerate some additional like activity and stuff like that. And she did great for waking up from anesthesia, no pain, like she's like feeling fine, obviously. Just like, why am I here and what happened?
So I'm just trying to think of anything else. So she's coming up on 9 months. What do you think of? She's not started, female. So I don't know if that surgery is something we can look into or not.
I mean, I don't, again, I would probably have her wear the Balto just so, and make sure whoever is doing it, like, knows her story really well and, like, what cannot happen, which is, like, this, and flopping around unsupported. Like, when we anesthetize these dogs, we treat them like they have broken. Even though I didn't suspect that she was really that unstable, you know, we move them, like, aboard, you know, so that they're not flopping around. So, not that we let other dogs flop around, but, you know what I mean? Just special care, you know. I literally say the words, treat them like their neck is broken, you know, to my nurses, just to remind them, even though they know. So I think it's just, I think you're probably far enough out. I think if you want to push it a couple more months, that'd be reasonable too. You know, she just has to be on her back for a space. So it's really, like, from a positioning standpoint, no big deal. And obviously you want to avoid pregnancy and pile and stuff like that.
Okay.
Sound okay?
That sounds like good news.
I think so.
Okay.
Okay?
Thank you so much.
All right, of course, I'll type everything up and send it over to you. It probably will be tomorrow because I'm going to send it to radiologists as well to, you know, just get the input on that too, so you have an official, you know, viewpoint for the rescue, and then we'll finish up everything with the rescue as far as the billing and stuff.
Thank you so much.
All right, of course. Let me walk you up front.
Thank you.